Thank you and welcome to my channel, Dr. PK Life. I'm Dr. PK. In this video, I'm going to discuss the stroke risk test modalities. What are the tests available to assess your risk for a stroke? Who should be screened? Anybody more than age 40 years. And younger people with diabetes, hypertension, obesity, smoking, hyperlipidemia, and a strong family history of a stroke. So, stroke risk screening modality. Number one is very basic, and that's most important. It's an essential tool, the blood pressure measurement, because hypertension is number one modifiable risk factor for a stroke. It should be done every visit or at least annually. Verdict: essential first step for all. Blood test, lipid profile, LDL, HDL, triglyceride. It'll tell you atherosclerotic risk. Fasting glucose, A1c, diabetes is a major stroke risk. Homocysteine and lipoprotein A. It's optional, but in high-risk individuals, it should be checked. Verdict: core screening for vascular risk. Electrocardiogram detects atrial fibrillation, a major cause of embolic stroke. Who? Adults more than 65 years or younger. If palpitation or irregular pulse is there. Verdict: important for arrhythmia detection. Carotid ultrasound or carotid Doppler. It checks for carotid artery plaque and narrowing. High-risk patient only, age more than 65, smokers, diabetes, known vascular disease. Pros: non-invasive, can detect asymptomatic carotid stenosis. Cons: not very useful for everyone, and it's low prevalence in general population. Verdict: selective use in high-risk or executive checkups. ABI, ankle brachial index. It compares the blood pressure in leg versus arm. It screens for peripheral artery disease, PAD. PAD strongly predicts risk of stroke and heart attack. So ABI should be considered. Verdict: simple, valuable vascular screening tool. CT scan MRI roles. It detects silent infarct or vessel changes. Too costly, not practical for screening. It has no diagnostic role, and it's not used for routine screening. Transcranial Doppler, TCD. It measures the blood flow in brain arteries, mainly in research, sickle cell disease, and specialized clinics, not a standard for general stroke screening. So, in summary, best to worst: blood pressure check, universal. Blood test, lipids, glucose, A1c, core lab. ECG, especially in older individuals, with people with irregular heartbeat. ABI, ankle brachial index, simple marker for vascular risk. Carotid Doppler for people with high risk individuals, not for general population. Brain scan, CT, MRI, they have no screening usefulness. Okay, they're diagnostic only. So thank you very much for watching my video.